Human metapneumovirus, or hMPV, is a virus that often mimics the common cold, causing upper respiratory infections. Most children catch it by age 5, and while symptoms are usually mild after the first infection, the initial encounter can lead to severe illness, especially in young kids. Adults over 65 and those with respiratory issues or weakened immune systems are also at risk for serious complications. hMPV spreads easily through coughing, sneezing, or touching contaminated surfaces. It's estimated that 10% to 12% of respiratory illnesses in children are due to this virus, with a small percentage developing lower respiratory infections like pneumonia. While hMPV and RSV share similarities, they affect different age groups, with hMPV peaking in severity between 6 and 12 months. Complications can arise, leading to conditions like bronchiolitis, bronchitis, or asthma flare-ups, and sometimes hospitalization is necessary. Understanding hMPV is crucial for recognizing its symptoms and knowing when to seek medical attention, especially during the winter and early spring when infections are more common. Healthcare providers usually diagnose hMPV based on your symptoms and health history. They might use a soft-tipped stick, swab, to get a sample from your nose or throat. A lab tests the sample for viruses and other infections. Keep in mind that you probably won't be tested for hMPV unless you have serious symptoms. Sometimes, your provider may also do a bronchoscopy or chest X-rays to look for changes in the airways of your lungs. There aren't any antiviral medications that treat human metapneumovirus. Most people can manage their symptoms at home until they feel better. If you or your child are severely ill, you might need to be admitted to the hospital. There, healthcare providers can monitor your condition and help prevent you from getting sicker. They might treat you with oxygen therapy. If you are having a hard time breathing, a provider may give you extra oxygen through a tube in your nose or mask on your face. 4 fluids. Fluids delivered directly to your vein, 4, can keep you hydrated. Corticosteroids. Steroids can reduce inflammation and might ease some of your symptoms. You can reduce your risk of getting hMPV and other infectious diseases by washing your hands often with soap and water. If you aren't able to use soap and water, use an alcohol-based hand sanitizer. Cover your nose and mouth with your elbow, not your bare hand, when you sneeze or cough. Avoid being around other people when you or they are sick with a cold or other contagious diseases. Consider wearing a mask if you are sick and can't avoid being around others. Avoid touching your face, eyes, nose and mouth. Don't share food or eating utensils, forks, spoons, cups with others.